Hello, this is Dr. Rakesh Sahay. I am Professor and Head of Department of Endocrinology at the Osmania Medical College in Hyderabad. Today on World Diabetes Day, I would like to give you some awareness about diabetes and how we need to live a good life with diabetes. So diabetes today is a major global health problem and it is increasing in epidemic proportions. And today we see that in India, we have almost 80 million people with diabetes. And the major problem because of diabetes is because of the complications of diabetes, which cause significant disability. Diabetes can lead to effects on the eyes with diabetic retinopathy, which is becoming a major cause of blindness. Then we have effects on the kidney, which lead to diabetic nephropathy, or renal failure happens because of that. And finally, there is diabetic neuropathy, which leads to amputations, which are not because of trauma, but diabetes is becoming a major cause of amputations. And apart from all this, diabetes is a major cause for heart disease. So it is very important that we understand how these complications develop and how we can prevent these complications. So that's the major message that I would like to give you today. The other important point that we need to understand is that diabetes in India is occurring at a much earlier age, and many of the young people are affected by diabetes at a young age during their productive years of life. And therefore, it is very important that we keep the diabetes under control to prevent the development of these complications. To avoid complications, we can say that we need to stay on track, where we are saying that with T, we say that you should take your medications as prescribed by your doctor. Never skip your medications. For R, you need to reach and maintain a healthy weight. Set your goals for weight loss in discussion with your doctor and eat healthy and exercise regularly. With A, we say that you add physical activity to your daily routine. And this physical activity can be in the form of anything like brisk walking or even swimming, jogging, whatever you enjoy doing. You should do this for about 30 minutes every day. And finally, when it comes to C, we are saying that control your ABCs. A meaning H1, HbA1c, that is an indicator of the blood glucose levels, then blood pressure, and C for cholesterol. And finally, for K, we say that kick the unhealthy habits like smoking. So finally, we say that with track, that is TRACK, that is taking your medicines regularly, reaching an ideal weight, adding physical activity, controlling your ABCs, and finally kicking the unhealthy habits, you will be able to prevent complications and live a healthy life with diabetes. And finally, in today's scenario of this COVID pandemic, what we also need to understand is that we need to maintain good hygiene, hand hygiene particularly, and also keep safe distance or a social distance from others when you're going in a congregation. All this is going to help you in maintaining a diabetic discipline and also preventing the complications of diabetes and leading a healthy life. So on this World Diabetes Day, let us take a pledge to maintain diabetes discipline and avoid complications because of diabetes. Thank you.